Hello, my name is Laura McAllister, and I am doing my persuasive speech over sex education in schools. I believe that sex education should be taught at a much younger age than it is currently being taught, and I am going to explain why in my speech. First of all, I believe sex education should be taught at a younger age because I have a younger sister, and she is currently homeschooled, but her friends are not, and I see her her friends doing things that they probably shouldn't be doing at their age, and it worries me. It worries me a lot. So I have come up with a plan, and hopefully you enjoy it. I believe that we should start teaching sex education at about 5th to 6th grade. At this time, we should be teaching things such as brushing your teeth, brushing your hair, and just keeping your body clean. It's simple. It isn't anything that is too upsetting to a 5th or a 6th grader, but it starts getting that image in their head about how we just need to be clean and kind of conservative. And then I believe 7th to 9th grade, we should start introducing what STDs are. Not to mention STIs, and then we need to explain the difference. STDs are, of course, sexually transmitted diseases, and STIs are sexually transmitted infections, and both bad, but one is definitely a lot worse, which is, of course, the diseases, and we need to explain why, we need to be careful. Then we get to 10th to 12th grade, and at this point, a lot of kids might already be sexually active, but we need to still go into detail about sexually transmitted diseases, maybe have some specific ones in mind, talk about the different ones and how we can get them, how to prevent them, how to treat them if at all possible, because most of the time there is not a treatment, and I'm not sure how many people actually know that there is not a treatment for a majority of STDs. So I believe this would help a lot, and it's a pretty basic plan just of when sex education should start in schools. So then we go to different statistics, and for my statistics I have a visual aid. This is the effectiveness levels of different birth control methods. So, for example, nothing. If you don't use any sort of birth control whatsoever, you have over an 85% chance of getting pregnant. And this is just with having sex one time. And once again, I don't think people realize that. I don't think younger kids understand the risk that they are going through. And so then you get to the ones, the 99.9% effective ones, which would be like the pill or the shot or the patch, or there's something called a ring. And maybe have, bring some girls in and explain to them if, they need to use these things, explain how. I don't think kids understand. You can't just take a birth control pill, skip a day and take two the next day and expect it to be effective. And I do think that's why last year we had 750,000 girls between 15 and 19 years old become pregnant in the United States alone. And we should not be having numbers like that. So I strongly think that if we explain the statistics of what, the effectiveness of birth control and different methods, then I think it would help, because for now schools are teaching abstinence, and as much as I would like to think that that's working, it's not, or we would not have 750,000 people pregnant, and so I think we need to be teaching something other than abstinence, so that if there are kids who are going to be sexually active, we can at least keep them from getting STDs and STIs. And so my next part of my speech is facts, just different facts about how we need to be teaching unbiased sex, because that is what works. that's what works. Abstinence does not work, and that is a fact. Like I said, 750,000 girls became pregnant in 2013 between the age of 15 and 19. And that's not including the 20-year-olds or the 21-year-olds, the girls in college, or, even the ones who might have been 14. Think about the girls who might have been 14 years old. So we need to just be careful of that, and we need to really start teaching this at a younger age, because parents, there was a survey that Psychos did, and over 80% of parents agreed to teach sexual education in schools, yet we still are not. And when I say we, I'm talking public schools around, the Mountain Home, Yellville area. And yes, we have something called a health class, and we go into a little bit of detail, but it's obviously not enough. If we look at these statistics and these facts, it is not enough. And I strongly believe that if we follow the plan of teaching kids at a much younger age about sex education, that we would not have these numbers, and we would have, a lot better view. A lot of people would not, they would probably take America a lot more seriously, because other countries are not having these problems. So, in conclusion, I believe we should start teaching sex education at a much younger age.